Good afternoon, Close the Gap community. Hasn't this been a great day? I know you just enjoyed that wonderful session on mental health matters. And now we have an even great session that I know all of you have been waiting for, and it's going to be on COVID-19 and the flu. My name is Leslie Fontenot. I'm Managing Director for Black Health Matters. So there are currently over 21.9 million cases of COVID-19 in the United States. This disease disproportionately affects Black and African American individuals. According to the CDC, the rate of contraction, hospitalization, and death are 1, 4, 3, 7, and 2.8 times higher, respectively, than white Americans. And while some symptoms of COVID-19 closely mimic those of the flu, we have learned that the two are very different in how they spread, infect, and multiply within the body. So today's presenter, we have Dr. Kimberlydawn Wisdom. She is the Senior Vice President of Community Health and Equity and Chief Wellness and Diversity Officer for the Henry Ford Health System. Dr. Wisdom is a board-certified emergency medicine physician, chair of the Gail and Lois Warden Endowment on Multicultural Health. In 2003, she was appointed by Governor Granholm as the nation's first state-level Surgeon General. In 2012, she was appointed by President Obama to serve on the Advisory Group on Prevention, Health Promotion, and Integrative and Public Health. She focuses on healthcare equity, infant mortality, maternal and child health. In addition to that, chronic disease, physical inactivity, unhealthy eating habits, and tobacco use. So please give us a warm welcome for Dr. Wisdom. Thank you for joining us today.
Thank you so much, Leslie, for that very kind introduction. And I'm just delighted to be here today to share a bit about COVID-19. And I'm going to primarily focus on the vaccine. Let me just pull it up here. Okay. I think we're set to go. I hope everyone can see my screen. And I'm going to be talking about let me just shift things over here a bit. Yeah, I'll be giving an overview. I only have about 15 or 20 minutes, so I'm going to move relatively expeditiously here through the slides because I want to allow enough time for Q&A at the end. But I will be primarily focusing on the importance of the vaccine, the safety and efficacy evidence, how the vaccine actually works, which I think is very exciting, and also who should get it. So I'm hoping over this short period of time that we have to help you understand more of the science behind the vaccine and the science why it's important to receive information about COVID-19's vaccine and hopefully to obtain the vaccine. Now, why is it important to be vaccinated? And it's important for a couple of reasons. One is for you as an individual because it helps to develop your immune response so that you can respond to the vaccine, and also if you develop, or are exposed respond to the virus, and if you're exposed to the virus, even if you've had the vaccine, it gives the illness is less severe. But also what's important from a community health and public health standpoint is developing that herd immunity. And that's where you're also protecting your family, your coworkers, and patients when you receive the vaccine, because not everyone, for one reason or another, is able to receive the vaccine, or they're so immunocompromised or immunosuppressed. So when others of us who can obtain the vaccine receive it, we actually protect our loved ones and our community as well. So in terms of what the virus and COVID-19 and heart disease, let me just shift this down a little bit. I know most of the session today was focused on cardiovascular disease, but in terms of COVID-19 and heart disease, If you have underlying cardiovascular disease or having experienced a COVID-19 infection would just make worse your experience with COVID-19. And we're also finding that being exposed to COVID-19 can also you can develop cardiovascular disease. You can develop an inflammation of the heart muscle. You can develop, it's a microvascular disease that can develop. So you can actually have, as a result of having experienced COVID, long-term or certainly impact to your cardiovascular system or to your heart. What I also want you to focus on, this is a picture of the COVID, the coronavirus, and you will see the spike. I want you to focus on that spike protein that I'm going to give a little bit more detail about, particularly as we talk about how the vaccine is made and what actually you're getting when you receive the vaccine. So the vaccine is safe and has been shown to be efficacious and effective in building protection against coronavirus. Certainly, it impacts the ability, our immunity is enhanced to um, experiencing COVID-19. Also, many people think, well, I have natural immunity, so they're less concerned. But the risk of severe illness and death from COVID-19 far outweighs the benefits of natural immunity. And also, COVID-19 vaccination will help protect you by creating an antibody response um, to the um, uh, to the virus. Okay, so the many of you've heard about two of the vaccines that have been made available through the Federal Drug Administration or the FDA under emergency use authorization, which means because of the serious nature of COVID-19 in this country and nationally, they've uh, created the opportunity for it to be used under emergency use. I do want to mention that in the development, though, of the vaccine, no corners were cut in terms of its safety and efficacy measures. The two viruses, and I'll talk about mRNA, but they are messenger RNA vaccines that have received this FDA emergency use. One of them is the Pfizer vaccine, and the other one is the Moderna vaccine. And Pfizer has been shown 95% efficacy 7 days after the second dose, and the doses are 21 days apart, and only 52% efficacy after the first dose. So it's important to get both doses. The Moderna vaccine has been shown to be 94, almost 95% efficacy after 14 days. After the second dose, and those are 28 days apart. So there's a little different schedule in terms of receiving the vaccine. The duration of the protection, though, is not yet known because we haven't had experience to know how long, but there's some sense that it maybe last 2 to 3 years. And both vaccines have been tested in diverse adult populations, including communities of color, African American communities, and other diverse communities as well. The safety and efficacy, same standards for as has been applied to all other vaccines has been used in this instance. And both the CDC or the Centers for Disease Control and Prevention, as well as the FDA, have both gone through very rigorous studies, data analyses in order to ensure that it is safe and effective. And if we do comparisons with other vaccines that you're already familiar with. The seasonal flu vaccine or the influenza vaccine is 44% effective, and we've known that. Chickenpox is about 92% effective. But when you look at the Moderna and the Pfizer vaccines, you see they approach 95 or over 95% effective. So when you compare them to other vaccines that have vaccine profiles in terms of their safety and efficacy, Moderna and the Pfizer vaccine are doing very well in that regard. Also, if we look at the clinical trials and the type of people that were part of those clinical trials in terms of the distribution of race and ethnicity, as well as a number of people that are enrolled, you'll see that 43,000 and 30,000 were enrolled in the clinical trials for between representing Pfizer and Moderna. Many sites, many countries, and you see the racial and ethnic distribution. You see that African Americans, although in a state such as Michigan, we represent about 14–15% of the population. You see there's a fairly reasonable representation of African Americans in the trial, as well as other diverse communities as well. And that was very much done by design, because from a public health standpoint, we call that generalizability. We want to ensure that we can um, generalize, or that the efficacy and safety apply to multiple diverse communities. So that was ensured in these clinical trials. Also, once vaccination is a key measure and a very important measure to arrest the pandemic, but also the same preventive measures are going to be important moving forward, even after you've received the vaccine. And that's, of course, wearing a mask and social distancing and washing your hands, and using all the precautions that you ordinarily would use, even though you may have received the vaccine. Now, here's the exciting part that I want to share with you in terms of the COVID-19 vaccine itself and how the vaccine works. Now, I mentioned before that spike protein. Now, the virus consists, and it's a little biology, but virology, but don't be concerned. I'm going to make it very straightforward. But the spike protein is one of 29 proteins that the virus is made up of. So the spike protein is only one. And that spike protein is the one that is what attaches to the cell, a healthy cell, and actually infects a healthy cell. So um, that is, a key protein in the brilliance behind the development of this vaccine. So what happens when you receive the vaccine? You're receiving some of that messenger RNA that actually codes for the spike protein only of the virus. So it kind of gets in your body, and it shows your body, it teaches your body how to make some of those spikes. And then your body recognizes those as foreign and develops antibodies toward those spikes. So then when you are confronted with the coronavirus itself, your body recognizes it as foreign, recognizes it as problematic, and those antibodies will attack and eradicate um, those cells. So I'm going to walk you through another version of that, but that's one version. So here again, when the vaccine carries that mRNA that I talked about, the messenger RNA, and that's what this vaccine is. The vaccine carries a tiny piece of the genetic material that teaches our cells how to make that harmless piece of spike protein, which is found on the surface of the coronavirus. That genetic material that we give, that mRNA, actually is degraded shortly after you receive the vaccine. The cells display that piece of that spike protein on the surface, and an immune response is triggered in our bodies, and it produces antibodies. It does not in any way affect our DNA. It does not, the messenger RNA does not go into the nucleus of the cell. So you cannot give someone COVID-19 with that one outside covering spike protein, because you're not getting the virus, you're just getting that spike protein. And the technology has been used the mRNA technology has been used in studies for influenza, Zika, rabies, as well as cytomegaloviruses and some cancers. So this is not new in terms of the technology. And if you even think about the word Moderna, it ends in RNA, and they've been doing RNA type research for quite some time, at least 10 years. So Tom Frieden, who's a former Centers of Disease Control and Prevention director, he explained it kind of nicely in an email message. He says an mRNA vaccine does not actually contain the virus itself. Think of it as an email sent to your immune system that shows what the virus looks like, instructions to kill it, and then, like a Snapchat, it disappears. The technology truly is amazing. So about the coronavirus, the side effects, and you'll see here the mRNA vaccine, typically vaccines will have some minor side effects, especially you'll see in this instance after the second dose. And only 2% of the side effects actually affect normal daily activity. And you'll see pain at the site, fatigue, headache, muscle aches, and some fever. And this usually occurs within 3 days of the vaccine and resolves within a couple of days. No significant safety concerns were identified in the clinical trials. And at least 8 weeks of safety data were gathered. And after that, it's unusual after 8 weeks to have any kind of side effects. Note though, if cough, shortness of breath, a runny nose, or what we call rhinorrhea, sore throat, loss of taste or smell, that is not consistent with post-vaccine symptoms. So that should you should contact a primary care provider or seek, medical attention for those things. And then you should wait at least 14 days between if you're getting if you haven't received the seasonal flu vaccine yet, don't get the COVID-19 vaccine and the seasonal flu vaccine any closer than 14 days in terms of proximity. Additional information about the Pfizer vaccine. It's approved for people 16 years of age and over. There are no contraindications for pregnant or lactating women that are breastfeeding. The components in the vaccine remain pretty much near the injection site where you receive the shot. There are no preservatives or adjuvants used in the vaccine. I know some people have had concerns about thimerosal and other preservatives that have been in vaccines for many, many, many years ago, but there are no preservatives here. The mRNA disintegrates that messenger, that little genetic material that helps teach your body how to make those spike proteins so they're recognized as foreign and attacked. That is degraded very shortly after the injection. And then typically we'll monitor you 15 minutes post-vaccination just to ensure, and if you've had an allergic history in the past, then there may be a sense of monitoring you even for 30 minutes. And I'm talking about allergy to bee pollen or food or anything like. If you have any allergy, you just may be watched a little bit longer. And so pregnant and lactating women can be offered the vaccine. And actually at Henry Ford Health System, 16,000 of our employees so far have received the first dose of the vaccine, and some are actually receiving the second dose. And some of us are on the list to get our vaccine very soon. And you'll see the ingredients there that are primarily a lipid moiety or a lipid component that actually allows the vaccine to be given. There's sucrose, there's sugar, there's potassium chloride. There are things that are, in salt. There are pretty innocuous ingredients that are in the vaccine itself. And additional information for the interest of time, I'm not going to go through all of these, but very, very similar profile in terms of the Moderna vaccine. And who should not get the vaccine? Primarily people that may have an allergic reaction. They've had severe allergic reactions before to vaccines or any ingredients in the vaccine in the past. And again, precautions should be taken if an allergic reaction to any vaccine or injectable therapy. And people will be watched for 30 minutes, even if they've had an allergic reaction in the past. Vaccine allocation, you may have heard that there are different phases and types of people that can get them, initially healthcare workers and long-term people at long-term care facilities, and now moving more to frontline workers. And those are a little fluid in terms of sometimes the vaccine allocation. So I would say to continue to reach out to various websites and what I'm going to share with you now in terms of when you may actually be eligible to receive the vaccine. And then in closing, there, henryford.com /community health is a way that you can obtain additional information related to the flu vaccine. And then that's my Twitter handle. As soon as I get my vaccine, I will be tweeting it out and sharing that information with community as well. So on that note, I am going to stop sharing my screen and I will welcome any questions. So I am going to look in the chat box and see if there are some questions that I can answer here in the just couple of minutes that I have left. Okay, have the COVID-19 vaccines had representation and diversity within the clinical trial? And I did share that indeed there was quite significant diversity, and that was very much by design in the clinical trial to ensure that we can say that it applies to very diverse populations in terms of its safety and efficacy. Is one of the vaccines better for African Americans over another? Will we get to choose which vaccine we want? Um, there's not one that's been shown scientifically to be better. I think what's probably most important, I have, tremendous confidence in both the Pfizer and the Moderna vaccine, and it's whichever one you're offered or you can gain access to. Like I said, the spacing between vaccine one and two, are injection one and two, are different. Pfizer's 21 days, the other one's 28 days. So ensure that you're available to get that second dose of the vaccine. But at Henry Ford, we're offering the Pfizer vaccine. That will be the one that I will be receiving. But I would just offer, I would take either one of those very confidently. Um, if you have had COVID, do you still need to get the vaccine? Absolutely, because we want to ensure that people have been affected by COVID a second time. So we want to ensure that you've amounted enough of an immune response so that you are protecting yourself from COVID-19. So I would say absolutely, yes. All of the literature supports getting that vaccine. I know I'm right at the top of the hour, and there are many more questions in the chat box, and I am going to defer to the Black Health Matters team. Thank them for the invitation, but defer to them in terms of, should I continue answering more questions, or we need to close out the session. And perhaps with these, we can post on a henryford.com/community health website responses to these questions, if that would be the more expeditious way to handle this. Okay, I will, I guess, continue answering questions until someone comes back on camera and lets me know that I can turn it over to the Black Health Matters team. Um, I've been doing a lot of study on the subject. How do I find out what exactly is in the vaccine? I understand that you cannot develop herd immunity from the vaccine, that herd immunity only can be achieved naturally. And I did share a bit in terms of what herd immunity is, and that's when others around you have received the vaccine and are immune. So you develop a environment that's safer for everyone, because others have received the vaccine. And what's exactly in the vaccine, I did share that, and we can post these slides too on the henryford.com/community health website. And you can see what ingredients, but primarily they're stabilizing ingredients. There aren't any preservatives in the vaccine, so it's safe from that standpoint. A lot of women of childbearing age are afraid of getting the vaccine. Can you discuss any research concerning the vaccine and the reproductive system? And I have to say, there hasn't been a tremendous amount of research because all of this is fairly great. I can continue for a few more minutes. Great. All of this is, it's being developed, but what we're understanding, even from the American College of Obstetrics and Gynecology, or ACOG, is that we're not finding contraindication to pregnant people receiving the vaccine, or women that are currently breastfeeding receiving the vaccine. I think the biggest concern is if a person who is pregnant, or a person, a lactating mom, to develop coronavirus. That is the greater concern related to those pregnant women. And women of childbearing age, there's no contraindication over the age of 16, and but there's no contraindication for women of childbearing age. Should I be concerned taking the vaccine with having high blood pressure? I would say there is no concern with taking the vaccine related to if you have high blood pressure. I would encourage you, though, to manage, and I know speakers were on earlier today, to manage your blood pressures closely to that ideal range of 120/80, whether you take medication to help maintain that healthier range, but you would want to do that anyway, whether you received the vaccine or not. So please take your blood pressure medication, take your diabetes medication, take all of your other medication. There are no contraindication to continuing your typical medication regimen and receiving the vaccine. Another question came, why such differences between the two vaccines? There are some differences, there are some similarities. Of course, they were developed by different manufacturers. And but by and large, the way they work using that messenger RNA mechanism is is very similar among both the vaccines. So we'd expect them to perform very similarly in terms of safety and efficacy. And I think with that question, I been asked to turn it back over to the Black Health Matters Close the Gap team. And thank you again for the invitation. And like we'll discuss how to finish answering all these questions for the listening audience, because I see there are quite a few unanswered questions in the chat box. Thank you again for your time and attention.